last lecture regarding protozoa and parasites. And just like the learning outcomes had been right from the first time I had contact with you, we are going to discuss them in terms of their life cycle and transmission, epidemiology and diagnosis, prevention and control. So we start with it's obstructing my view. Okay. So we start with Toxoplasma gondii. Some people also call it Toxoplasma gondii. So I guess that's the American way. You can take your pick as long as you get the spelling right. Now, this parasite is another example of a sporozoid, not sporozoid. I'm sorry, I'm having some form of brain block. How did we classify Plasmodium species? Under what group of protozoan parasite does the Plasmodium fall under? Sporo what? Remember that protozoan parasites can move when they produce pseudopods. We say they are Sarcodina, right? Those that move with flagellates, Mastigophora, right? Those that move with cilia, Ciliata. What's the fourth group? I can't seem to recall. Yes, they're epicomplexa, but they fall under what group? I can't. Anyway, they're epicomplexa because during reproduction, during replication, remember I told you that these organisms don't have recognized organ of locomotion. But at a stage during their replication, they have this developmental stage that has a lot of hydrolytic enzymes packed in an organelle that is located at the apex of that intermediate developmental stage. And that's why we refer to them as epicomplexa, because they have that apical hydrolytic complex. So Toxoplasma gondii is another example of an agent that is classified as an epicomplexan. The definitive host is the domestic cats and other animals in the cat family. Humans and other mammals are intermediate hosts. So what does that tell you about this parasite? Yes, humans are accidental hosts. Yes, I agree. But what else does that tell you? If the definitive host is the cat, what does that mean? Pardon? Sexual reproduction occurs in the cat. Very good. And what form of reproduction will be in humans? Asexual. So how else can you define the life cycle of this parasite? Indirect, right? And complex. Very good. Very good. Why do you say it's complex? Yes, we have intermediate hosts, but what is going on? You have sexual reproduction alternating with asexual reproduction. Is that clear? So this is another example of an epicomplexan with a complex life cycle. The definitive host is the cat because, like we all rightly observed, sexual reproduction occurs in the cat. The organism is usually acquired by ingestion of cysts. Now we are talking about acquisition in humans. It is usually acquired by ingestion of cysts in uncooked meat or meat that is not properly cooked. You know, there are some dishes in which you don't cook the meat very well. These kind of dishes can transmit the infective form of Toxoplasma gondii. It can also be transmitted when we ingest oocysts in cat feces, and you know what this means in a moment. Now, unlike the other parasites we've discussed, maybe except Plasmodium, this parasite can also be transmitted from a pregnant woman to the unborn child. through the placenta. So you can have vertical transmission, particularly if the woman is coming in contact with this parasite for the first time. Human to human transmission, apart from a pregnant woman transmitting it to her unborn child, is not known to occur. So what is the life cycle like? Again, you can see a lot of arrows, just like we had with Plasmodium, right? So let's try and figure out what is going on. The infective stage that we find in the environment are the oocysts that are released in the cat feces. Now, when these cysts are freshly passed in the feces, they are unsporulated, that is, they are not developed enough. So the sporulated cysts, or the sporulated oocysts, are the infective form. Now, the usual cycle is depicted by the red arrow. So the usual thing is the cat, infected cat, will pass out the infective form in the feces, in the environment. Then you have the intermediate organisms like small rodents or poultry that will peck at food in the environment, and in the process, they pick up the infective form. In this intermediate host, the infected oocyst transforms into what we call tachyzoids and eventually into bradyzoids. These bradyzoids are usually enclosed in a cyst, so we see them as tissue cysts. Now, when a cat feeds on the intermediate host, the tissue cysts are ingested and the life cycle continues. So this is the usual thing that happens with this parasite. But unfortunately, humans can get exposed to this parasite and then we become the accidental host, because unless the cat feeds on a human dead body, the life cycle stops there in humans. Is that clear? So what happens? How do we get exposed? When we have the infective form in the environment and the intermediate host, in this case it's poultry, unless we feed on rats. Rats are not so important in the human transmission. But with poultry, what can happen is that when we have the tissue cyst and we prepare dishes that we consume raw or poorly cooked, the heat that we apply in cooking the food is not enough to destroy the tissue cysts, then we can actually ingest the infective form and get exposed to the parasite. Another way through which we can get exposed is when the cats pass out the infective form and it gets into the livestock feeds, cattle and pigs. We can also end up getting exposed to the tissue cyst when we ingest poorly cooked meat from these intermediate hosts. Another thing that can happen is that if you have a pet cat that you're not really paying attention to, and the cat gets infected, the infective forms are present in the feces. So if you handle the cat litter, or if you place the cat litter in the kitchen, because the oocysts are very tiny structure, air currents can disperse them in the kitchen. They can land on your food, they can land on the drinking water, and then you end up consuming this. So this is another way through which we can get exposed. Another way is through blood transfusion. If an infected blood is transfused, it can actually establish infection in a susceptible host. Other ways through which we can also have transmission includes having a pregnant woman getting infected and passing it on to the unborn child. But whatever the route of acquisition, just remember that humans are not the usual intermediate host. So when we get exposed to this parasite, we are like a dead-end host, okay? So what happens after exposure? After infection of the intestinal epithelium, the organism converts from being in the tissue cyst form that contains bradyzoids. From the name brady, that means slowly dividing. It switches to an actively dividing trophozoite stage that we refer to as the tachyzoids. So these tachyzoids are able to invade different cells in the body, like macrophages, and because of this, they can be dispersed to different organs in the body. So they can end up in the brain, in the lungs, in the liver, and in the eyes. Indeed, this organism is one of the organisms that we use to define AIDS. So it is regarded as an AIDS-defining organism. A patient with HIV infection that shows symptoms of Toxoplasma gondii is believed to have progressed to AIDS. Okay? You can have HIV infection and then you can have AIDS. By that time, the T cell count has fallen below some critical set levels. So this organism is an AIDS-defining agent. Progression of the infection is usually limited by the competent immune system, usually the T cell arm of the immune system. Cell-mediated immunity plays the major role. However, antibodies are produced against certain antigens that can enhance the control of replication of this organism. Congenital infection of the fetus occurs only when the mother is infected during pregnancy for the first time, because once you have exposure to the organism and the immune system is competent, the immune system is going to control the division of this parasite, and it switches from tachyzoids to bradyzoids. The bradyzoids are not actively dividing, although the organism is still viable. But it's like the immune system has put a lead on it. So although it's active, it's not allowed to move around, okay? So if a woman has been exposed before getting pregnant, she would have produced antibodies against the antigens of the parasite, and the T cells would have controlled replication of the parasite. As a result, she does not pass the parasite onto the baby. Even if she gets reinfected in another pregnancy, her immune system, there's always a memory component to the immune response. That memory response will prevent her from transmitting this parasite onto the baby. Now, in terms of epidemiology, this is a very cosmopolitan parasite. Anywhere in the world where you have mammals, you can be sure that Toxoplasma gondii is present. I'm sure if we all submit our blood samples for serology, most of us will be positive, although we don't show symptoms. So most of us have been exposed, but because the immune system is competent, we don't have any symptoms. Infections tend to occur sporadically, but you can have an outbreak situation, okay, which is associated with certain, dishes. Maybe you went for a party and some special or exotic dish was consumed, or the source of water was contaminated, then you can have an outbreak. But that outbreak can be traced to a particular event, okay, if you do the epidemiological surveillance. So we know how infection can be acquired, and we know that we are a dead host. We can't pass it on to the cat for the parasite to complete its life cycle. And because the immune system is competent, we may not have overt clinical signs. So how do you make a diagnosis? It depends on how the patient presents, okay? And the diagnosis will be based on how the patient presents. So if the patient has symptoms of CNS involvement, central nervous system, you may want to send in different tissues. You may want to send in the CSF as well. So what do we look out for? For microscopic examination, we can stain different preparations, and what we are looking out for is the crescent-shaped trophozoites or the tachyzoites. These are the actively metabolizing vegetative forms. So these are the trophozoites in a stained tissue smear. Okay? We may also see cysts in the tissues, and this is an example of a cyst. The entire structure is a cyst. Within this, you have the bradyzoids. The bradyzoids are the form of the parasite that is not actively dividing. They are viable, that means they are alive, but the immune system prevents them from replicating. Okay? Now, for the diagnosis of acute and congenital infection, so that's in the baby, we can perform an immunofluorescence assay. You know what this means, right? You know what immunofluorescence means. You've had your lectures, right? Okay. So we can perform immunofluorescence assay for immunoglobulin M. Remember that immunoglobulin M is the first antibody produced in response to an antigenic challenge. Now, in a baby, it's possible for maternal immunoglobulin G to cross the placenta to the baby. So if you perform immunofluorescence assay for immunoglobulin G, you cannot really determine the origin of that immunoglobulin G, because you know that particular subtype of antibodies can cross the placenta to the baby. But if you screen for immunoglobulin M, that is the baby's own immune response. Immunoglobulin M is a large molecule. It cannot pass through the placenta to the baby. So if you get a positive hit, that is evidence that the baby was exposed and the baby's immune system is responding. How can you prevent infection? We know the various routes of acquisition, okay? So you can avoid contact with the cat litter if you're pregnant. If you have to handle the cat litter, you have to wear gloves and wash your hands immediately. Of course, don't put the cat litter in the kitchen. Don't allow your cat to roam around and feed on wild rodents in the environment. And when you eat, make sure that you cook your food adequately. Avoid microwave cooking for meat, because this may not really get to the center of the meat where you're likely to have the tissue cyst located. Avoid raw vegetables at restaurants, because you just don't know how well they were washed. So what are you really consuming? Avoid raw shellfish, because you can have the oocyst contaminating rivers and streams. Avoid raw goat meat, because you can actually have the parasite passed in the goat milk. When you prepare meals, wash your vegetables with potable water. Wash your hands and all your cooking utensils adequately. Make sure that your source of water is really potable. And if you like gardening and outdoor activities, wash your hands thoroughly and brush your nails after any outdoor activity. Wear gloves if you can, and avoid ingestion of water during recreational activities in the lakes and rivers. So that's it with Toxoplasma. Let's move on to another protozoan parasite, albeit a protozoan parasite that is of low medical importance in terms of its occurrence and disease association. Although the organism is not a common cause of human infection, when it does cause an infection in humans, it can be devastating. And the organism is Acanthamoeba species. There are different types. Now, they are microscopic and they are free-living amoebae. What this means is that you have them as facultative parasites. Remember the very first lecture we said we can have facultative parasites. They can switch between a parasitic life cycle or just being there in the environment causing no trouble. So this is an example of a facultative parasite. It can cause rare disease, like I said, but when it does cause infection, it could be severe, and it tends to go for the eyes, the skin, and the central nervous system. The organism is present worldwide, usually in the environment where you have water and muddy soil. The organism can spread to the eyes through the use of contact lens, or when you have cuts and you go swimming in a lake that has the organism, or you have a skin wound and the water used to irrigate the wound is not free of the pathogen. It can also be inhaled into the lungs when you dive into the swimming pool or into the lake having fun. Now, there are three distinct clinical conditions associated with this organism. Remember, we said it has a predilection for the eye, the skin, and the lungs. So you can have what we call Acanthamoeba keratitis involving the eyes. You can have what we call granulomatous amoebic encephalitis, which involves the central nervous system. Or you can have a disseminated infection in which the organism is, you know what the word disseminated means, widely distributed within the system. Now, a good example that is common in human infection is a Acanthamoeba called Batsoni. What is the life cycle like? Now, the cysts and the trophozoites are present in the environment, okay? Because this organism is a facultative parasite, the usual thing is it switches between, the cyst form, becomes the trophozoites develop, and that's it. And cyst on vegetation and what have you. That's the usual free living cycle of the parasite. But when humans now encroach into the environment by going to swim in the lake or in the stream, we may get exposed to both the cyst and the trophozoites, okay? And they can enter into humans through various ways. One is through the eyes. So you dived down and then you opened your eyes in the lake. That is offering the organism a portal of entry, if it is present there. It can also enter through the nasal passages to get to the lower respiratory tract. So there's no way you're going to dive into the lake or stream and you won't have some droplets of water going up your nostrils. It can also go through ulcerated or broken skin. So you just had a tattoo and you went for a swim in the lake. That is offering the organism a portal of entry. So depending on the portal of entry, the clinical presentation may be keratitis, okay, involving the eyes, or you can have involvement of the central nervous system, or you can have infection of the skin. Now, one thing I want you to note is that with Acanthamoeba species, there is no flagellated stage because we're going to discuss another amoebic agent that has a flagellated form. That's Naegleria. So the basic difference between the two, apart from their names, is that with Acanthamoeba, you just have the cyst and the trophozoites. The trophozoite and the cyst can both get into the human system, but most of the time the trophozoite causes infection. How can you prevent contact with the organism? Particularly for people who wear contact lenses, you have to be very careful. Do not use tap water to clean your lenses. Do not put on your lens when you're having a shower because you're not sure if your water is free of this organism. So you prevent contact. Don't go swimming with your contact lens on in lakes and streams and things like that. Another free-living organism that is also a facultative parasite is Naegleria fowleri. Just like Acanthamoeba species, they can switch between a free living non-parasitic life stage and a parasitic life cycle stage. Naegleria fowleri is also referred to as the brain-eating amoeba because of its predilection to cause the most problem in the brain. The organism is referred to as a thermophilic agent, that is heat-loving, and it has a worldwide distribution. And because it's thermophilic, it's usually associated with warm, fresh water, like you have in lakes, rivers, and hot springs in the tropics and the subtropics. It can also be found in muddy soil, so it loves moisture. The organism Naegleria fowleri is the only species of this genus that is known to cause infection in humans. And most of the time, you find it associated in freshwater habitats. And when it is living a non-parasitic life cycle, it's feeding on bacteria present in the environment. When it causes infection in humans, the route of access is usually through the nose when we are engaged in water-related activities. Once in the nose, the organism can access the brain and can cause a severe brain infection that is referred to as primary amoebic meningoencephalitis, and it's usually fatal. Now, apart from swimming in lakes, this organism has also been associated with the tank water supply in some mosques in certain areas of Pakistan. There was a report, I think about a year or two ago, of people who went to pray in the mosque and came down with this condition, and it was traced to the overhead tank that was supplying water for ablution in that mosque. And Dr. Atif told me that there have been reports of cases in the eastern region in Saudi Arabia. So this is an important organism that you should really know about. How is, pardon? Okay. Now, how is the organism transmitted and what is the life cycle like? Now, in the non-parasitic stage, the life cycle is depicted in red. So the red arrows shows you what happens when the organism is not infecting humans. And like I said, the basic difference between Naegleria and Acanthamoeba is that there is no flagellated stage associated with Acanthamoeba species. However, with Naegleria, you have three stages: the cyst, the trophozoite, and the flagellated form. Now, the flagellated form is not pathogenic, but it's important in dispersal of the organism in the environment because they are motile. They can actually swim from an area where you have a lot of parasites to another body of water where you have lower level of parasites. So this is important in the spread of the organism from one body of water to the other. Now, how do we get infected? When we go for water-related activities such as swimming, diving underwater, then we can have water being forced up the nose. And that's what the organism wants. You've given it access. Since it's a motile organism, the trophozoite is motile, it will find its way into the brain, and then it's going to cause an infection. The infective stage is the trophozoite, just like with Acanthamoeba species. This is in contrast to the protozoan parasites we discussed earlier, Entamoeba histolytica and Giardia. Remember that with these two organisms, the cyst is the infective stage. That is the stage of the parasite that will cause infection in humans. However, with Naegleria fowleri and Acanthamoeba, although they have the cyst stage, they do not cause infection. Rather, it is the trophozoites that will establish infection in humans. So how can you make a diagnosis? If you collect a sample of cerebrospinal fluid in a patient with active symptoms suggestive, that is the history and the clinical presentation, and you have this organism in mind, if you collect the CSF, we can actually find the motile organism in the CSF. We can also perform molecular assays looking for nucleic acids of the organism in the CSF or at times in biopsy specimen. So maybe after death, you want to be sure what led to this rapid decline in the patient. So you can send in brain biopsy tissue for analysis. We can also perform serology, looking for antigens associated with the organism in cerebrospinal fluid or biopsy specimen or any other tissue specimen. How can you prevent infection? You know how infection is acquired, right? So you have to discourage people from areas where there has been outbreaks. So you have to put up notices so that people don't go to these areas to swim or dive. Well, if they have to, because it's very difficult to control human nature, then tell them to use a nose plug so that they don't have fluid going up their nostrils. Because if you swallow the water, it's okay. The trophozoite cannot survive the passage through the GI, okay? And remember that the trophozoite is the infective form, okay? You can also chlorinate the body of water, particularly if you have recreational swimming pools. You can chlorinate it because the trophozoites are susceptible to chlorine. They will be destroyed, okay? Another protozoan parasite that is important is Trichomonas vaginalis. And from the name, you can guess the tissue that is involved, the genital tract, right? It can cause infection in both females and males. In males, it tends to be found in the urethra and the prostate. It tends to divide by simple binary fission. Now, unlike all the other protozoan parasites we have discussed, where you have a cyst and then the trophozoite, with Trichomonas vaginalis, there is no recognized cyst stage. It exists as the trophozoite only. As a result, humans are the only hosts to these parasites. Because there is no cyst stage, it cannot survive in the environment. So you don't have environmental reservoirs. It's only an infected person who is maybe not treated adequately or is asymptomatic that is a reservoir for the infection. Is that clear? So the organism is acquired through intimate contact, okay? And in women, it tends to cause profuse vaginal discharge with an offensive odor. And when you examine the woman, it's like the discharge is frothy. That is, it looks like you have gas bubbles in the discharge. How can you make a diagnosis? Send in a genital specimen, and we look out for motile trophozoites. So the trophozoites looks like this. It's a flagellated organism, and we look out
Doctor?
Yes.
Doctor, can I ask a question?
Yes.
Is it affected only female?
No, I cited that both male and females are affected. But never mind. I think there's a bias against women. That's why you have Trichomonas vaginalis. It's not, named after the male. Okay?
Okay, thank you so much.
You're welcome. So how can you prevent infection? Practice safe sex. What do we mean by safe sex? Now, one thing you should tell people is try and keep to one sexual partner. That is a safe sex attitude. But then you are not sure if your partner is faithful to you. So if you're not so sure, use barrier methods like condoms, whether male or female condoms, that will prevent the physical contact and transmission of the organisms. Another way to prevent is when you get an index patient who is infected, treat adequately and ensure that all the sexual contacts of that particular index patient is treated. So if the patient tells you I have 10 sexual partners, don't be judgmental, just encourage him or her to bring all the partners for treatment, okay? Because humans are the reservoirs, we know that. So if you treat adequately, you're going to break the chain of transmission. Oh, thank you. Oh, there's one more parasite. Did I put up the wrong slide? There is Babesia. I have to discuss Babesia with you. Just a minute. There's one. Babesia, we just added it yesterday, so maybe that's why I came up with the wrong slide. Sorry. Can we just have it? Yeah, that was a problem. I had to stand and fix, please. Now, while we are putting up the slide for Babesia, Babesia is another protozoan parasite that may be confused with malaria parasite. Okay? However, the organism is not transmitted by mosquitoes. It is transmitted by tick bites. Okay. Yeah, I think, oh, okay, I should have put this up. Yeah, this one. Yes, it's the same. Yes. Okay, let's open it on my slide and then I'll just give the talk on the slide. Okay. Yeah. Thank you. Okay, so sorry for that mix-up. So Babesia species is an example of a zoonotic infection. So we get this from animals, yes, because animals are the reservoir of infection in the human population. The usual agent of transmission is Ixodes scapularis. Now, this particular species of tick is very important because they also transmit Lyme's disease and a viral disease that was recently identified about maybe 3 or 4 years ago, Powassan virus, which can give you a very bad clinical presentation and you may miss the diagnosis if you're not paying attention. So this is a very important agent that transmits Babesia. Humans, however, are opportunistic hosts to the parasite because we are not the usual intermediate host. However, because of our activities, we may be exposed to this vector, and in the process, if the vector is infected, we can end up with an infection. Human infections have been associated with these species of Babesia. So you have Babesia microti. This is common in the US. Divergence is common in European countries. Duncani, and recently, according to the CDC, there is a new strain that is yet to be given a name. It is designated as MO1. Now, what is the life cycle like? Just like with Toxoplasma, humans are not the usual intermediate host, okay? So the red arrows shows you what happens when you have the normal definitive host and the normal intermediate host interacting, okay? So the tick is the definitive host for the parasite, while the mouse is the intermediate host for the parasite. And just like we discussed with Plasmodium and Toxoplasma, these two hosts, different things occurs in them. In the tick, you have sexual reproduction taking place because you have fusion of the gametes, whereas in the mouse, you have only asexual reproduction taking place. So this is another example of a parasite that has a complex indirect life cycle. Okay? And in this case, it's the tick that is the definitive host because this is where sexual reproduction occurs. Now, what happens when you have an infected tick feeding on humans? Just like what happens with Plasmodium infection, sporozoites are released from the salivary glands of an infected tick into the subcutaneous circulation, okay? Like you have with malaria parasite, these sporozoites are going to be dispersed. But unlike what happens with Plasmodium, where you first of all have an exoerythrocytic cycle, there is no exoerythrocytic cycle involved in the replication of Babesia species in humans. Rather, what you have is direct invasion of the sporozoites into the red blood cells. So just like malaria parasite, Babesia species are associated with invasion and destruction of red blood cells. So anemia will be part of the clinical presentation. The trophozoites will develop into merozoites. Now, the merozoites, once they are formed, they have a characteristic arrangement. They are arranged in fours, tetrads. So they give rise to what we call the Maltese cross. It's like you have a cross. Now, this is diagnostic of Babesia infection. However, if you look at the trophozoite stage, you may actually misidentify this as Plasmodium infection. And that is why in areas where you have malaria predominant, it's difficult for you to make a diagnosis of Babesia species unless you have a very high index of suspicion, okay? So apart from the bite of the vector, you can also have Babesia species infection acquired through transfusion of blood and blood products, through organ transplant. The donated organ may have the infective form, or a pregnant woman can transmit it to the baby. It has a worldwide occurrence, but in areas where you have malaria prevalence that is high, it's very difficult to say anything about Babesia in such environments. And I already told you earlier that the trophozoite stage is indistinguishable morphologically from that of Plasmodium. So in a Plasmodium endemic area, the usual thing is for the lab to report trophozoites of Plasmodium species seen, okay? In Europe, most reported cases are due to divergence, and when a patient is splenectomized, that is, the spleen has been removed, it increases the risk of infection and also the devastation of the resulting disease. In the United States, Babesia microti is the agent most frequently isolated, and it's associated with the northeast and midwest states in the US. It can also occur and cause infection in non-splenectomized patients. That is, this particular species is a little bit aggressive. It can cause infection in both splenectomized and non-splenectomized patients. Babesia duncani has been isolated in patients in Washington and California. So far, these are the two states that have been associated with infection due to this particular species. MO1 has been isolated from a patient in Missouri, and so far, there hasn't been any report of this particular species in any other states in the US. How do you make a diagnosis? Because this is a blood tissue parasite, the sample you send to the lab is the blood sample, right? What type of preparation is this? What? Thin. Very good. Why do you think it's thin? because the red cells are preserved. Very good. Now let's look at the micrograph in the lower frame. The arrows are pointing to the trophozoites. Now, if you look at this one that is, I didn't put the arrow on, you can see that it's difficult for you to say this is not Plasmodium, right? If I give this to you in the exam, the first thing that comes to your mind is Plasmodium, right? Am I right? Yeah, so that's why it's very difficult to have any data in areas where malaria is endemic. However, if you are a trained microscopist, you will notice that there are some parasites outside the red blood cell. This is highly suggestive of Babesia species. Apart from that, if you look at this particular parasite, it's like there's a whitish dot inside there, right, in the cytoplasm. Remember I told you, you have a thin rim of cytoplasm that appears bluish. There is a central vacuole that doesn't pick up the stain, and then you have the nucleus or the chromatin dot at one eccentric location, giving you the appearance of an engagement ring. So we say the trophozoites are ring-shaped, right? Now, if you look at this particular parasite, it's like you have the double chromatin, the headphone appearance. Remember we discussed that with malaria parasite, P. falciparum, right? So this looks like it, but there is this pale non-staining area. You may think it's an artifact, but it is not. It is actually a space that can help you differentiate Babesia from Plasmodium trophozoites. This is not something that we see with Plasmodium species, but it is associated with the trophozoites of Babesia. So you need to be a trained microscopist to be able to appreciate this. You agree with me? What you can make out as an untrained microscopist is that the arrangement of these merozoites is in tetrads, right? You can appreciate that there are just 4 merozoites that are arranged in the Maltese cross fashion. So if you see this, it's diagnostic of Babesia. Is that clear? We can also perform serology because there are parasite-specific antigens to which the body produces antibodies. We can also screen for genetic material associated with the parasite using different molecular assays. And how can you prevent infection? The tick is usually found in highly wooded area where you have a lot of trees. So for prevention, it's not easy for you to have like a global approach to things because you have a lot of reservoirs. Remember we said it's a zoonotic infection? You have a lot of reservoirs. You're not going to go killing all the livestock, all the dogs, and what have you. You can't do that. So the best thing is for you to protect yourself as an individual. So what can you do? If you've gone out into the woods for whatever reason, when you come back, check your clothing for the lymphal stage of the tick. And this is because these are the ones, although the adults can transmit the agent, it's the lymphal stage that are very good at transmission because they are very tiny. They're just the size of a pinhead. So you may not see them, you may not notice that they are there, and then you come back inside, they are stuck to your seam, the seam of your pants and what have you, and they feed for a very long time. They need that long period of feeding for them to transmit the parasite. So you have to actively check for these agents when you come back from a wooded area. Another thing that you can do is to make sure that when you're going out, cover your pants with your stockings. Your stockings will be white. Hopefully you put on white socks. Don't put on colored socks because you won't see the nymph because they're just tiny dots. So put on something whitish And when you come back, remove it and examine it for tiny, tiny brownish specks, which you may miss out if you've gone with just your pants with nothing else. Okay? And of course, you should wear shoes. You can also use repellents. All these are personal protective approaches to prevention of the tick latching onto you. Any questions? So this concludes our discussion on protozoan parasites. When next I come, we are going to be discussing the helminths,